Hi, my name is Dr. Vincent Martin. I'm a professor of medicine at the University of Cincinnati College of Medicine and also co-director of the Headache and Facial Pain Center in the University of Cincinnati Gardner Neuroscience Institute. And today, Sarah, one of my patients, is here, and she's going to talk about a number of different topics. But to start, what we're going to do is talk about your headaches. And I think you told me that you had at least 2 different types of headaches. Is that correct?
Yes, it is.
Okay, and then I want you to describe your migraine type headaches, the more severe ones, like where they're located and what the quality of pain is and other things that you might get with the headaches.
I was first diagnosed with migraines when I was about 14, and they've been pretty much constant in my life since then. Mostly throughout my life, they've been kind of on the left side of my head. For the past year and a half, for the past 2.5 years, they have not really gone away ever. I have not had a headache-free day in the past 2.5 years, and they have been constant on the left side, pounding, and the pain level has been between a 6 and a 9. I've ended up in the ER twice because of the pain.
So what kind of impact do you think that these headaches have had on your life?
Dramatic. I went from being able to work and hold a job to not being able to concentrate, to not being able to read well, to focus, to look at a column of numbers, to almost do anything well. It's been extremely dramatic. I can't really do much.
So you've received a diagnosis of chronic migraine, which are more frequent headaches, but you also, in addition to that, get a secondary headache type. Can you describe that for me?
I also get, I guess you would call it
cervicogenic, so
yes.
Headaches that arise from the neck.
They are caused by probably issues with the spine. Where the spine goes into the base of the skull, and those are another horrible issue, and it's hard sometimes to tell the difference between those and the actual migraines. They are all very very challenging and very painful.
And so those headaches are mostly in the back of your head, is that correct?
Yes.
And with those headaches, what would the typical pain severity be on a 0 to 10 scale?
Probably about an 8. They're very painful.
About 8, okay.
Yeah.
And then do you get nauseated with those or sensitive to light or noise with those?
Very sensitive to light and noise. I don't ever go outside without sunglasses. I am very sensitive to noise. I could not possibly ever go to a baseball game or a concert anymore. I listen to the television on a very low level.
Mm-hmm.
I did try to go to watch the fireworks this year, but I ended up having to leave before they even started because the noise of the crowd, even before it even started, just was too much for me, and I had to leave.
Mm-hmm.
So I can't do it.
Now the thing, or at least one of the things that makes you unique, don't you think, is this diagnosis of something called EDS, or what they call Ehlers-Danlos syndrome.
Mm-hmm.
Can you describe that for the audience?
Ehlers-Danlos syndrome is a genetic condition that is a collagen defect in the body. And what makes EDS a challenge, and why I'm wearing this pin that says that has a zebra on it is,
And so am I.
yes, is because EDS is known as a zebra disease because when doctors hear hoofbeats, they always think of a horse because it's logical that horses are the first thing that you think of when you hear hoofbeats. So EDS is a disease that is rarely diagnosed. It's not necessarily a rare disease, but it is rarely diagnosed. It's probably 1 in 5,000 cases, but it is probably diagnosed to the tune of 1 in 50,000, which makes it fairly rare. Some of the hallmarks of EDS are things like, well, I don't know that you can see it, but my legs are triple crossed, which means that I've got my legs in a curly Q. My thumbs can do this. My pinkies can bend to 90 degrees. My elbows can't do it. His can. He won't show you, but his can.
Oh well, mine bent back like that.
Yeah. And my knees, if I stand up, my knees will go backwards.
They buckle backwards.
Yeah, they buckle backwards. And I can't palm the floor, but he can. He also has EDS. So we're both kind of zebras in that respect. I wasn't diagnosed until I was almost 40, and a week away from my 40th birthday. Although I have been telling doctors since I was probably about 14 that something was wrong with me. I would get extremely tired. As opposed to my peers, I would have extreme fatigue. Even in high school, I couldn't keep up with my friends. I was always in pain. Like I would have issues with my ankles and my knees. I would just always rotate my ankles and knees just constantly. Just horrible issues that nobody could find a reason for. And the headaches, nobody could find a reason for them. To the point of, on every single chart that I have going back for the past 15 years, and I actually got copies of all of my charts, they all say extreme fatigue, extreme headaches, and nobody comes up with a reason for it.
So you think that many doctors might miss this diagnosis?
I think that many doctors have missed this diagnosis, yeah.
And what are some of the other symptoms that you can get with EDS?
You can get a lot of different symptoms. There are GI symptoms are very common. You can get diagnosed with fibromyalgia. That's a very common diagnosis that people get as a diagnosis first because of the trigger points. You get a diagnosis of fibromyalgia. Often people get diagnosed with IBS. You can get diagnosed with obviously big joint issues, with arthritis, early onset arthritis.
Joint dislocations.
Yes, constant joint dislocations. I know of some people who have had children almost taken away from them for their children's joints being dislocated so many times, that they thought that their children were being abused, when in fact they would, literally it was that their children's joints were being, it wasn't until they went into the hospital for something else and the children's joint came out of dislocated in the doctor's hands, and the doctor went, "Oh, I don't think you're doing this to your child." And the parents were like, "I'm not going to say I told you so, but," so, things like that. There are some people with EDS who have vascular issues that can be a complication. It is a rarer complication, but it's not unheard of.
But that's a rare form, though. So most people that have the joint hypermobility or the Ehlers-Danlos type 3 don't have the vascular, but there's a vascular form of EDS, and those people can be prone to stroke and heart attack. But I don't want people to think that the more common form is associated with that.
Yes, exactly. It's very, very rare. It's very rare, and we are very grateful that 90% of the people with EDS do not have that form, and it's not an issue for most of us. For most of us, it's joint dislocations. It's things like like for me right now, I have my shoulders taped because my shoulder was popping out of a joint yesterday, and so I had my shoulders taped into place because they kept coming out of joint, and it was easier to tape them into place than to fight them coming out.
Now let's talk about this concept of this, craniocervical instability, or what's called CCI, which can be a complication of the EDS. So that's basically where the ligaments between different vertebrae and the cervical spine, which is up in the neck, they tend to slip on one another because the connections or the ligaments between the vertebrae are lax. Mm-hmm. So you get some movement on there, and you can actually get compression of nerves as they come out of the spinal cord. So describe what kind of symptoms you get with that. You already mentioned the headache in the back of your head. Mm-hmm. Could be that.
You can also get, I have no idea if any of you have noticed, but my voice is changing just a little bit. So part of that is that my voice is, my throat is being compressed by my spine as part of CCI is that for me is that my CCI is pushing onto my esophagus. So my vocal cords and my esophagus are being pushed, and so it is becoming harder to swallow, and my vocal cords are being compressed. So my voice changes multiple times during the day, and it's harder to swallow. That's one issue. Another one is that I have issues with my hands and my feet going numb, which becomes, it's not such a bad issue yet, but it's becoming an issue because obviously you don't want your hands and your feet to go numb. And when it starts to become an issue where you can't feel your hands and your feet, then that is
it's a bigger issue.
Yes, and you can't regrow those nerves. So you want to fix the CCI before you have that sort of nerve damage, because once it starts to get to that point, you need to fix the instability before it gets to the damage occurs.
So we're going to talk about some of the tests that you can get to diagnose that.
Okay. So one of the tests that I had run, and Dr. Martin was very helpful in getting that done, was called a flexion extension MRI. And this is not a common MRI that most doctors have run. And in fact, most doctors are not happy to have it run because it's not a common MRI. And what happens is you go to an MRI center and you are either you're normally lying down and you're stuck in an MRI and you're stuck like this, and then you're stuck like this. You normally have a rice bag in front of you and a rice bag behind you, and you are lying there and it does not feel good. I'm not going to lie. He's laughing. He probably hasn't had one done. And they measure certain angles, and then they send the report off to Dr. Martin, and he reads it and he says, oh, okay, fine, whatever. And then you have to send the discs off to certain doctors who are well trained in knowing about EDS, and who are neurosurgeons who are well trained about EDS. There are very few of them. The problem with neurosurgeons is that there are not many who understand EDS. So you get a lot of neurosurgeons and a lot of radiologists who read. A lot of radiologists read a MRI, even a flexion extension MRI, and they are like, "Oh, you're just fine. You're fine. You're fine. Whatever." And a EDS literate neurosurgeon will say, no, you're really not fine, because they will understand the mechanics of an EDS neck and say, well, wait a minute, there are issues with the ligaments and the issues, and they will argue that this is a problem. So an EDS literate neurosurgeon is a very important thing to have in your arsenal if you're having CCI issues. There are very few, and you have to research them on the internet. And I highly recommend looking for them.
And then sometimes they'll even recommend like rotational CAT scans and so forth. So there are a number of different tests they may recommend. And there's also some that will recommend an upright MRI where you're standing,
Yes.
which can only be done at very, very few centers throughout the country as well.
Yes, I had one recently done in New York. They're basically like 3 places in the country you can do them. You can do them in New York, you can do them in Washington D.C., New York, and like California or something like that. And again, the same things with those MRIs. You have to send those discs to the same sort of doctors who understand how to read them. I am lucky enough to have sent my discs off to one of those doctors who is reading my MRIs and is willing to look at them and talk to me about them.
And then just to kind of finish this up is rarely, if there's a great degree of instability, there may be certain surgical procedures that are necessary to stabilize the spine. So I think with that we're going to move on to the next topic that happens in EDS, and that's this concept of mast cell disorder. Can you describe what kind of symptoms you get with your mast cell disorder?
So mast cell activation syndrome, or MCAS, is a condition where your body decides that it's going to be allergic to anything and everything at any given moment. You basically don't know what you're going to be allergic to, and you can't predict it. So I might not be allergic to grass today, and tomorrow I might. I might be allergic to latex gloves today and not tomorrow. So MCAS makes it really difficult to be a patient. And it makes it very difficult for doctors to have us as patients because they write in very big letters, allergy, on your chart.
To everything.
To everything, yeah.
To like multiple medications,
Yes.
to multiple, sometimes foods. They can have a really long list of potential allergens or foods that they have intolerances to.
Yes, and as I said, it might be one day you have an allergy to something and the next day you might not. The problem with MCAS is that most people think of an anaphylactic episode as being solely a throat episode, and you can only have throat anaphylaxis. You can also have anaphylaxis in your gut. You can have other forms of anaphylaxis. So that can be a challenge because not all doctors recognize other versions of anaphylaxis. So you have to kind of be a little careful with that. I am lucky. I have a doctor who understands MCAS and who is very aware of how to handle it, and is helping me navigate all of this, and is help me be diagnosed properly, and is helping with all of that. I take 5 medicines for MCAS, literally. And one of them is 4 times a day. It's a little liquid that I put in water 4 times a day. And my family all looks at me like, what are you doing when before meals? And I'm like, sorry, it's, gotta do it if I don't want to be sick. It has made a huge difference in my life, and it has really helped me have a much more even health issues have calmed down quite a bit since I've been on that protocol.
So just so that people know what this is people who have this mast cell activation syndrome, their mast cells, which are part of the allergic response, are hyperactive, basically. And these mast cells can release all these different chemicals that can produce things like flushing, so people will get real red. They will also develop, they can develop diarrhea, they can develop wheezing, they can develop something, this basically where they get redness when you scratch you actually can write an S. That's called dermatographia, and you can see how her arm is becoming red, dermatographism. They have.
I shouldn't do this. I'm on 5 medicines.
They can get unexplained anaphylaxis, so they'll have swelling of their throat, they'll have swelling of their airways, they can have swelling of their arms or legs. Usually they don't have an explanation. You may only have one in your entire lifetime. You can develop, a chronic fatigue, from this as well. So it's a disorder. So what you do is you try to treat all these chemicals that are released with all these different drugs to try to block them. And this is something that can be fairly commonly seen in patients with EDS.
So if I wasn't on these medicines, this would have come up much more raised and much more aggressively. But since I'm on these medicines, it only came up as a red line. But because I'm on all these medicines, it just came up as a flat line, and don't worry about it.
What would you tell people, what would you tell the audience in kind of closing, what would you tell people about how to manage EDS or these other things like CCI and or mast cell disease? So what would you tell them?
One of the big things I would tell them is if you think you have a chronic disease like EDS or CCI or mast cell, is to get a binder and start keeping track of things. I have a binder that I keep all of my discs in. I keep all of my doctor's reports in. I keep all of my after visit summaries in, all of my blood work, all of my everything in. And I don't carry this to every doctor's appointment. But I carry it to all of my new doctors. I carry it to doctors who I haven't seen in a while, doctors who I only go to see once or twice a year. And I scan all of my reports and I put them in here and I hand them out to doctors like they're candy, and I say, here, you might not have seen me for a while. Here's a copy of this report. Here's a copy of that report. And that way they can have everything. And I have it in here and I can just reprint it. And it makes it really easy for me to know that I have it all. but yet it's all centralized on my computer, and it's makes it really easy for my doctors that they know it's all on here. Another thing that I do that makes at least Dr. Martin's nurse love me is I keep a copy of my medicines on my computer, and I write a list of all my medicines, and I alphabetize them, which she really loves, and I write down what they are, what dosage they are, and what doctor prescribed them, and what date they prescribed them. And then at the below that, I write what medicines I've been on that haven't worked, and then maybe what medicines I've been on that I've had an allergic reaction to.
Yeah. So you need to educate your physician. So.
Yeah.
So I think in closing, what I would say about EDS is that it's a real disorder.
It's
That
very
these
real.
a lot of these patients are not psychiatrically ill. They just have a real medical disorder that needs to be recognized, and that you may want to try seeking out doctors and/or other health professionals that actually have some knowledge in the disorder to both make your diagnosis and also to develop a treatment plan.
And don't be afraid to change doctors. I mean, that's one of the biggest things that I have learned is that don't be afraid that just because a doctor has worked for your friend or your aunt or your uncle or a cousin, they might not work for you. And that is one of the biggest things that I have learned. And I run a group here in town. If I've learned one thing, it's that just because a doctor works for one person does not mean that they're going to work for you.
Yep.
And it's very important to find somebody who is going to work not only, is going to work with you and is going to be able to be on your side and advocating for you as much as anything else. And that's one thing that I've learned that you are willing to do for me is, you're going to help me through any of this and everything of this. And that's the very important thing for me about having a doctor is that I need my doctor to be right there going, hang on a minute, that's not an acceptable response to said medicine. Let's backtrack and figure out what's really going on. So EDS is a challenge. It's a challenge to diagnose. It's a challenge to treat, and it's a challenge to live with, and it's especially a challenge to explain to your family a lot of the time. And there are a lot of people who are going to say, that's not a real disease. And that's a really hard thing to live with sometimes. And I've found that online support groups are often warmer and friendlier places than
the doctors.
They can be, but they're often warmer and friendlier than your own families.
Wow. Wow. Well, with that, I think what we're going to have to do is we'll close. But I want to thank you very much. That was a very excellent interview. So,
Thank you, Dr.
okay.
Martin.